Welcome back to your OncoCare Advisor. This is Dr. Raghav here. I want to talk a little bit more about metastatic breast cancer today. Welcome back to your OncoCare Advisor. This is I saw someone a few days ago who unfortunately has been going through stage 4 breast cancer. But let me explain the important points to note here. She was diagnosed with, I think, stage 2 or stage 3 breast cancer some time ago. Unfortunately, after years of being without any treatment, it came back in her bones. So what is the first step one should do if there is a new spot in the bone? Biopsy. A biopsy is a must. Why is a biopsy necessary? Especially for two things. One is to prove that this is metastatic breast cancer, because the first time it showed up somewhere. And second is to evaluate for these ancillary studies or extended studies called estrogen, progesterone, and HER2. Because sometimes when the cancer travels from one place to another place, it can lose its signals. We call it de-differentiation. So basically means that it can become from hormone positive to a hormone negative. So hence it's very important to know that status before we consider treatment. So the first step, when we find out that she was having some pain and we did a scan and we found a spot in her pelvis, we did the biopsy. Biopsy proved it was breast cancer and it was hormone positive. HER2 was low, meaning 1+. So at this point of time, our next step, since she was not on any treatment and she was a postmenopausal, meaning that she already had achieved menopause, we started her on something called letrozole. She was on letrozole for a good almost 2 years, and at this point of time, unfortunately, she developed another spot on the other side of the pelvis, actually 2 spots. And this raised concern that this hormonal therapy or endocrine therapy or letrozole probably was not working enough. So what are my choices at this point of time? My choices were twofold. One is add something called CDK4 inhibitor like palbociclib, abemaciclib, or ribociclib, or change the letrozole to something called fulvestrant, which is an injection. Or since that is the only site and she was having some pain, you could give radiation and then continue the endocrine therapy of some sort. So these were our choices. So what she decided to do was she did not want radiation, so we decided to change her to fulvestrant at this point of time, because she had limited cancer and not as much symptoms, and did not want to experience the side effects of the CDK4 inhibitor. So we did that for another year, then now started progressing again. So at this point of time, we added the CDK4 inhibitor. And her choice, we started with ribociclib, but later had side effects, so we dropped it down to palbociclib. So at this point of time, she's on palbociclib and fulvestrant and has been doing quite well without any evidence of any further cancer growth all this time. So what did we understand from this situation is, one, anytime cancer presents with a new spot or first time diagnosis of what we call stage 4 or metastatic breast cancer, a biopsy is essential to establish the diagnosis as well as to know the hormonal status of this cancer. Second, what kind of treatment is decided based on several factors one should consider, your doctor should consider, which are, one, age of the patient, the patient's symptoms, meaning that if they're having any pain or any other symptoms, and knowing the options, option 1, 2, 3, what are the pros and cons of each option, and seeing what's the best thing that the patient wants to do. So it's called shared decision making. It means you hear the options and then you feel like, hey, I would like to do this because of this. Or if you don't know, you can ask your doctor, hey, I'm not sure, what would you recommend me to do? So the 3 learning points here are a biopsy and establishing the diagnosis and the studies that are necessary to decide on a treatment. 2, your treatment decision is based on several factors, including cancer-related factors and your factors. And 3, shared decision making, making sure that you have that conversation with your doctor to decide what is the right treatment for you, especially in the setting where we may not be able to cure this, but we're in some ways prolonging as long as we can. Okay, I hope this was helpful. Again, I will cover another case in my next video, but if you have any questions, comments, thoughts, or any particular scenario you want me to talk about, please DM us here. Thank you.